he goes to this magic shop in the mall to check out the particular item that he's lost, and he wants to replace it. In the magic shop, Ruth, who's the mother of Neil, is it, who owns the magic shop? Ruth, a woman in her 50s at that point, roughly, and Jim is 12 years old, 11 at the time, takes him under her wing and offers to teach him magic, but not of a magic that you could perform on stage, but a magic that will see you through life. And I will not go into the teachings because I'll let Jim tell you about that. But Jim learns from this woman, and they have a 6-week intensive, really, where he goes there every day, and she gives him these teachings. The teachings are essentially the mindfulness teachings of traditional spiritual practices, although Ruth doesn't put it, I don't think she ever put it in those terms to you. And we never know from the book where she learned them herself, right? Jim, of course, comes from a highly dysfunctional home, doesn't do well in school as a result, as you would expect, but develops the intention to become a physician. And there's even a doctor that visits your school at some point who says to you, well, if that's your dream, you can do it. I can see it in you, he says. Through a set of what you might call serendipitous circumstances, which may be not serendipitous at all, given Jim's intention, he goes to medical school, despite the fact that his grades were not up to medical school standard when he first applies. He makes it happen. And then he, similarly against the odds, gets accepted into a neurosurgery residency at Walter Reed Hospital, an Army hospital. And where's Walter Reed? New Orleans?
Washington, D.C.
It's in Washington, D.C., okay. So he becomes a neurosurgeon, and he's clearly recognized as having extraordinary skill and talent, at least in a technical sense, for that kind of delicate surgery. He, not unnaturally given his background, he has the ambition to become very wealthy, very successful, very well known. Is it a Ferrari or a Porsche you wanted, or both?
Well, it was initially a Porsche, but I like Ferraris too.
Yeah. So you'd settle for a Ferrari, but yeah. So it's a Porsche, and he ends up having his Porsche. More than one, right?
Yeah.
And he ends up having the wealth. He ends up having the marriage and the beautiful home and all that a poor boy's heart could ever want. Not heart, actually, a poor boy's mind could ever heart. Could you make that distinction? And then, but you're not happy, really. And at some point, Jim gets very wealthy. I mean, he attracts a lot of money to him. And then he loses it. Just the vagaries of the market being what they are, the money is all gone all of a sudden. And he could still, there's a pivotal point in the book where there's some money that he donated to a fund for some charitable purpose, that if he were to pull his money back out of that fund, which he finds that he could do, he could be a wealthy man again, instead of being in debt. And he decides, no, I gave my word, I'm going to leave that money in the fund. It's kind of an extraordinary story. And from that decision, and I'm not going to go into how you become truly wealthy in a way that now you define wealth. His marriage, of course, breaks up. His first marriage breaks up. And anyway, he resumes his medical. He has a near-death experience at some point, by the way, which I'll ask you about. That's early in the game. But he becomes a neurosurgeon, or he continues his career as a neurosurgeon. You found, or you support, or you lead a neurosurgery center of excellence in Mississippi, was it? In an area of dire poverty and real economic and racial oppression, actually. And you do this even while you come back to California, because now you have a new family, a new wife and child, but you commute back and forth to Mississippi to do that work and his work in California. And at the end, Jim founds an organization called Center for Compassion and Altruism Research and Education. Is that right?
CCARE.
Yeah, CCARE, which is located at Stanford, is that right? And meets the Dalai Lama and Thich Nhat Hanh, all these great spiritual teachers. So here he is gracing our class with his presence. And so, is that a fair summary of your story? Anything you want to add to it?
I probably would have told it a little better, in more detail. Yes.
Okay. So, can I just plunge in with questions then?
Sure.
Okay.
How was everyone?
Sorry?
Your mic's a little scratchy.
Oh, come on.
Typical.
Yes, come on. Okay, I like that. Yes.
Is it still scratchy?
It's better.
Is it better? Okay, thank you. So to start again, Jim is... First question I want to ask you is, two of the dramatic incidents in the book, and you begin with one of them. You're operating on a young child, if I remember right, in his brain, and the resident who is assisting you is holding a vein that needs to be clamped shut, otherwise it'll bleed and this boy's life is threatened. And the resident loses his grip, something happens. His attention goes somewhere else for a moment, and all of a sudden blood fills the cavity or the space in which you're operating, and there's this loose vein now somewhere deep in this lacuna, bleeding, and this child is really literally exsanguinating on the operating table. And the anesthesiologist has to perform CPR on him under the table.
So the child is 4 years old, and the child is prone because the tumor's back here, and the head is open, and this unfortunate resident made an error, and he ripped this vein, and the child is exsanguinating. This is a very large vein that drains a lot of the venous blood supply. So there's blood flowing out of this child's head, and we can't get control of it.
And where I want to pick this up is he's got this tremendous technical skill, but it's not his technical skill that he relies on at that moment. He actually drops into, Jim does, not a desperate technical search for the vein. And I want you to describe what happened to you internally, but a deep state of mindfulness and the intentionality, actually. Mindfulness and intentionality is how I interpret that experience. So just tell us what you did and what you experienced and what happened for you at that moment.
Well, I think for almost anyone in this room, if you're in that situation, what would be the natural thing? You would be terrified, right? Because you're seeing this child who's literally, he had a cardiac arrest. And the natural tendency is to go there because, frankly, you're terrified. And you don't want to be the person who kills this child. But at that moment, as that blood is oozing out, I reflected back on these lessons that this woman had taught me, which was to go and be absolutely present. I had to stop everything except for being there. And when I was in that space, I could see where that vein was. And it allowed me to calmly take a clip, reach into this field filled with blood, and place the clip there. And suddenly, the heart has stopped beating, and they're pumping on his chest. When that happens, suddenly the heart starts again. The bleeding stops, and then the child comes back. And at the start of that story, which actually introduces the book, this child and his mother is looking to me, and I'm reassuring them and telling them everything's going to be okay, and that's what I believe. And fortunately, it ended up being okay. And at the end of that story, this poor child, I'm terrified because we've had a period where the child's had no blood supply to his brain. Now, fortunately, children are much more tolerant than we are. And, I took care of the issue, closed the wound, put a head dressing on, and I was very concerned this child would not wake up normally. And in fact, I had told the mother this, but the child opened his eyes and was breathing on his own and talked immediately and was perfectly fine.
So you seem moved when you talk about that experience. And I tell you, I feel moved being in your presence when you talk about it. So it's still very alive for you, isn't it?
Yes, of course. Yeah. The thing is, so many of us, we make big effort not to show this.
Yeah.
Because why? Because you think people are going to judge you, and you don't want to look weak. And it's funny because I give a lot of talks, and I had a psychiatrist come up to me one time, and she said, "Jesus, I noticed as you're talking, you had tears, your voice broke." She goes, "If you spend 3 sessions with me, I can get rid of that." Yet this is what we want to be. Because you see, as soon as I can show my vulnerability, it allows you to show yours, and we connect. And you cannot connect without being vulnerable. You cannot truly connect. And that's when you truly see the other person, and you let down those barriers and you become vulnerable. And that's where you start really having meaning in relationships.
Thank you. And a number of people in this workshop have already apologized for being vulnerable. What you said about the psychiatrist, I have this standard question. What do you call somebody who wants to fix in somebody else something they haven't resolved in themselves?
A psychiatrist.
Called psychiatrist, yeah.
No. How many physicians are in this room?
Yeah.
So the people who you looked up at in class and said, "Boy, they're really messed up," they're almost invariably the ones who go into psychiatry. Now, of course, there are exceptions, okay? Because I know there are 3 or 4 psychiatrists, and they're going to, "Jim Doty's such an asshole. He said this horrible thing." I'd be facetious. But
I would like to come back to talk to you about the medical ideology and the medical education that we both received. But to come back to your story again, so there was another incident later on in the book where now you're operating on an adult woman who's a singer, and you particularly love her music, and again it's a dire crisis situation in the middle of the operation, and quite uncharacteristically for you, you start shaking, which is not what you want in a neurosurgeon necessarily. And again, there's 2 things about that. Again, you drop into yourself, and that's how you find it's not through your technical skills. You're very confident in your technical skills, but that's not what got you through again, was it? It was your capacity to somehow go deep inside?
No, in this instance, this was a woman who had a aneurysm sitting in her speech area, and it had not ruptured actually at that time, but over the period of time of meeting with her and talking to her, I became friends with her, and I'd recommended she see other people, et cetera, to get other opinions, and she came back and said, I want you to do this operation. And
in fact, you're the only one that she felt safe enough to do
Yes.
it. Yeah.
And the thing was, she'd given me her CDs, I'd listened to them, so I'd become emotionally connected to this woman. And you cannot, when you're a neurosurgeon or a surgeon, you have to become a technician. You no longer have any connection to their humanity. And in this particular instance, as I opened her skull up and exposed this aneurysm, literally it was about to rupture. The wall was so thin you could see the blood swirling there. And this is near her speech area, which would be where her voice and it comes from. And so as I was about to put the clip on after I had dissected it out to separate it from the circulation, I thought of her as a human being. And I became very emotional, and my hand started shaking, which that's not a good thing. So I went back into this space and recentered myself, and in this case, not to be more vulnerable, but to be less. To go back into this place where I'm a complete technician and not connected to her humanity. And one of the challenges with doctors is because sometimes this hurts so much that they permanently separate themselves and they can't get there to hold you, to be with you, and you feel they're distant. And I'm not sure if, I think it's good, but I can go back and forth between these situations, and I can hold somebody and cry with them. And many times, I tell our residents that my successes as a physician, and even as a neurosurgeon, with all the technology we have, it is just as important to have your heart there and to connect as it is every aspect of the technical parts of this. It's that important for you to be there, because a lot of times what people are ailing from is not a physical illness, but it is an illness of the heart. Is it an illness of their disconnection from themselves? It is an illness of the pain they have suffered. And if you can't see that, because that's what needs to be healed, oftentimes it's not the physical part.
That's extraordinary that you would say that, because it's just not what I expect to hear from a neurosurgeon. It's as a family physician and working in addictions and palliative care, that's what I learned. That, and I've said this to this group just yesterday, that in my view, not all, but most chronic illness does originate in that disconnection from the self.
Absolutely.
But it's extraordinary to hear it from, really is, from somebody whose skill is basically that of a really highly honed technician.
Say a brusque, arrogant, egotistical neurosurgeon.
Well, you said that about yourself. You talk about your arrogance in the book, so I'll come to that too.
But okay. Can I tell you a real quick story that connects to that?
Please, yeah.
So I had a woman who came in to see me, and this was a woman. She was in her late 20s or mid 20s. She was somewhat overweight, a bit disheveled, wouldn't look me in the eye, but she came to me for a second neurosurgical opinion because it had been recommended she undergo an operation to fuse her spine. And when I looked at her x-rays, she had a very minimal disc bulge, which should not be causing the severity of her back pain. And this led to me taking an interest into why she's really here. And that's the difference, right? Because if somebody had actually sat with her and asked her a few key questions and had been observant, the first question was, tell me about your childhood. And this was after I noticed that she had scars on her wrists. And her childhood was one where her mother got divorced, When she was 11, her mother remarried at 12, and her stepfather raped her. The other key question is something called, do you have dyspareunia, which is pain with sex. She did, absolutely, every time. It was so painful for her. So her issue was not that disc. Her issue was the pain that she had been carrying with her since she was 12. So I connected her with an adolescent psychiatrist. She came back to see me in 6 months, lost 60 pounds, had a smile on her face, and no back pain. See, that's being a real doctor. And that's, unfortunately, we don't see enough of that. And certainly within, look, there are tons of wonderful neurosurgeons, but to take the time to connect, to listen, to be with someone so that they are open, they're vulnerable, and they tell you the truth. Because, most people have shame of when situations like this occur. They have despair. They don't think there's anybody to listen to them. Yet, you can see this written on their face if you simply learn how to look.
A couple of things that occurred to me when you mentioned this story. One is, do you know the work of John Sarno at all? Yeah, so the back doctor. And so I won't say more about him except that he's a rehab specialist who said exactly what Jim just said about most back pain, which is that it's not the X-ray findings that explain the pain, but what the person is carrying emotionally inside. So, a lot of people get operated on, not for the pain they're having, but for the X-ray results.
Well, and, I have to tell you, I'm probably the lowest paid neurosurgeon at Stanford.
Yeah.
Because my job is to be a doctor, and I only get paid if I operate. And I will tell you, 3/4 of the people I see don't need an operation on their back. Yet half the people I see is a second opinion because it's been recommended they have surgery.
The other point in relation to what you said, I imagine, but perhaps, are you familiar with the Adverse Childhood Experiences Studies, the ACE studies?
Oh, sure.
Yeah, okay. Well, so Vince Felitti, the lead investigator, he's a medical doctor himself, and he told me once that they actually did a study where the new patients coming into the clinic would just fill out a questionnaire about their lives, including their childhoods. And those people that filled out the questionnaire, as opposed to those who didn't, and you have to keep in mind, they didn't even talk to a human being. They just filled out a questionnaire. They were just asked a bunch of questions. The very fact of filling out the questionnaire reduced the number of medical visits significantly. Just the fact that somebody had asked them anything about themselves. Now, coming back to yourself now, so this person, Ruth, so this may be an obvious question, but you had all the hallmarks of a classical traumatizing childhood. And it's not that as an adult you completely escaped the residue of it. But nevertheless, you did get through it, and you were able to learn from it. What was it that allowed you to do that?
So to add a little more to this, my mother had a stroke when I was a child and was partially paralyzed and had a seizure disorder, and she was chronically depressed. So in addition to this other experience, she also attempted suicide multiple times. And of course, to be a child should never be in this situation, right? Where you have to make adult decisions and act as an adult. You should be a child. And so you can understand if you grow up in these situations, especially associated with poverty, and more so if you're a minority, the likelihood of you overcoming this is almost like that. Because the baggage you carry, the pain, the despair, the fear, it carries with you. And you can't trust anything because you never know what's going to happen to you. And the thing is, I used to think this was a rarity, that I was suffering alone and nobody had this experience. But when I talk to people, a huge number of people have these traumatic experiences as a child that carry with them. It's like a monkey on your back. And you haven't had the opportunity to let that monkey leave you. And what happened to me, and this really shows you the power that each of us has to change the life of another, but sadly, the power that we give away to others, and we allow them to make decisions for us. We stop believing in ourselves, our own potential. You know, when I met this woman, Ruth, the reason I connected with her was because she created for me an environment of psychological safety.
Mm-hmm.
When I walked into this store, she knew nothing about the magic. She was just literally sitting there while her son ran an errand. But what did she have about her? She had a presence. She had a radiant smile. I could tell that in our conversation, she didn't judge me. What happens when you see someone who looks like they're poor, a minority perhaps? You immediately make a judgment about them, right or wrong. And the problem is, many times it's completely wrong, and you have no idea the burden that that person is carrying. So by creating this environment where she was open, she didn't appear afraid of me, she treated me as if I was her equal. She asked me questions and allowed me to respond. And I felt okay. I wasn't afraid. I didn't think she was going to judge me. I didn't feel I had to lie to her to hide my background or who I was. And so at the end of this, this woman said to me, she said, you know, I really like you. I'm here for another 6 weeks, and if you show up every day, I think I could teach you something that could change your life. Now, how many of us get that gift? And it's an extraordinary gift.
You know, in one of her books, Alice Miller asked the question, why is it that some kids who have very difficult, terrible circumstances make it through and others don't? And she says that what makes the difference is the presence of an empathetic witness. Somebody who can't necessarily change the child's situation physically, but can validate the child as a person. So it really sounds like Ruth, apart from the specific teaching she gave you, was also that
absolutely
empathetic witness for you.
Yep, absolutely.
She taught you a lot about the power of intention. And I want to ask you about that, because you clearly, at various crucial junctions in your life, formulated an intention. And for the most part, even envisioned the outcome, including the Porsche. And these intentions very often really were materialized in your life. So I want you to talk about that, because in this New Age world, there's so much talk about just imagine this, that, it's going to manifest in your life. And that's not the kind of intention you seem to be talking about. So can you make that distinction?
Well, you know, many of you probably heard of the prosperity gospels and The Secret. And I will tell you, I'm not a fan. Because when it's all about you, it's nothing. And this was actually a lesson that I learned. But getting back to your specific question, it has to start, though, with where we started and how I got to understand this.
Mm-hmm.
When you grow up in a circumstance like I grew up, it's a form of trauma, and you have this post-traumatic stress. And, you know, veterans, when they come back, you know, they're waiting for shells to go off. A kid, you're waiting for somebody to scream at you. You're waiting for something to be thrown. You don't know if you're going to eat. You don't know if you're going to be evicted. So you're constantly anxious and stressed. And when you're constantly anxious and stressed, you cannot attend and be present, right? And so the first thing that Ruth taught me was we now call a survey, because I had no idea that my muscles were tense and I'm always like this. So she taught me this body survey to relax with a breathing exercise while focused on a candle. And the thing about that was that, as we now know, and remember this was in 1968, we didn't know about neuroplasticity, mindfulness was not talked about, but as you know now, when you do that, then that shifts. It shifts you from this stress mode, this engagement of your sympathetic nervous system, this flight or fight response, to your rest and digest system. And when that happens, many things happen. But one thing that happens is you go from this reactive mode to have access to your executive control functions. So you're much more discerning, you're much more thoughtful, you're much more there. And once I was able to master that, and that was not easy, because, people tell you have ADHD. Well, no, you have trauma. Once I was able to master that and sit, then I could be present. And the next thing that she taught me, though, from that was an understanding that, let me ask you a question. How many of you have a voice going on in your head all the time? Okay. How many of you, that voice is not one of positivity and self-affirmation? Right? And this is part of the baggage. And this is what I was talking about when you give up your power. You see, that negativity, unfortunately, is a product of our evolution. When people tell us how great things are great, it goes off of us because it doesn't threaten us. Negative things stick to us, and we get this negative voice in our head. And we believe that that negativity is our voice, but it's a construct. It is not us at all. It is what we have become to believe is us. So every time you say you can't, it's not possible, you're giving your power away. How many of you have had people, when you express a dream, an aspiration, say, that's not possible, you'll never do it? Anybody have that happen? Right. And sometimes these are people we love. And you know what's so horrible? I talk to people, and they'll say, my dad told me, you'll never amount to anything. They've carried that their whole lives. Now, and sometimes that can help you, and you can, move forward with that. But why do you need that? Versus somebody saying, I love you, and you can do it. And that's just as powerful, if not more powerful, and it doesn't hurt you. This is why you have to think about the words that you say to other people. Because you see, you think they don't matter, but they do matter. Imagine a parent one time saying to their child, and they carry it with them their whole life. So what happens is this negativity, this voice you've created, you start laying down bricks, and it starts creating a prison for you. And the walls get higher, it gets darker, and then you don't believe you can do anything. But who created that? You created it. You have allowed that to happen, which has given your power away. Yet, when this Ruth made me understand this, made me see that negative dialogue was not me, but was this artificial construct, then the walls broke away. When she taught me that I could change that dialogue from negativity to one of self-affirmation, to one of loving myself, to one of believing that I deserve love, A lot of people have a hard time believing that they deserve to be loved.
But this is where I want to ask you about, to go back to my question, is that a lot of these New Age mental technologies do teach these simple affirmations. I'm a wonderful person, I'm a success, and so on. But there's something missing, and I have the same reaction as you do. I don't want anything to do with it. I'd like to read you a paragraph that you wrote and ask you to comment on it, okay? I still visualize what I want in life. I see it through a window in my mind, which often isn't quite clear, and then I trust with absolute faith that when the time is right, it'll be crystal clear. I've learned that this process of manifesting isn't always linear and doesn't always operate on a timeline that is as desire or makes sense, but whatever I visualize usually manifests, and when it doesn't, there's clearly has been a good reason it didn't. Over the decades, I have learned that having faith in the outcome is quite different from being attached to the outcome. And I've learned it the hard way that you have to be careful about what it is exactly that you want to manifest. I have also learned that there's immense power contained in one's intention. So you're talking about much more than that simple affirmation, that simple, the secret kind of thing. So just, if you would expand on what you say here, including the non-attachment to the outcome and everything else.
Well, I think that's what many of us have a tendency to do, is that it's great to set a goal, but when you put your worth into what the outcome is, and you feel and you start craving, and you have this attachment, and if you don't achieve it, then you beat yourself up. And there's not a person in this room who's going to have every goal or desire met. But that being said, if you set your goals so you don't let them destroy you if you don't meet them. How many of you know the term equanimity?
I've heard about it.
Master. We have a tendency when things are going great, what do we want to hold on to? The great thing. We want people to say, you are so great, you accomplished this, and that was amazing, and you're the greatest guy in the world, and I love you, and this is fantastic. But those are transitory, right? Yet we have a tendency to want that because it makes us feel good. It is an affirmation in some way. And then what invariably happens is it goes down. And bad things happen, and things you would prefer not to happen, and you suffer and you're in pain. But if you think in your life, what is the events, those events that have given you the greatest wisdom, insight about yourself and the world? Is it up here, or is it the things down here? Yet, if you understand all of these are transitory, and you have an evenness of temperament where you appreciate the great times, but you're not attached to them. You enjoy them while they're present, but you don't crave them all the time. That doesn't dictate your behavior. And that the bad times, they're not so hot, but they're also transitory, and you can learn something from them. When people, let's say, become a quadriplegic from a car accident or something, do you know what's interesting? Within a year, the vast majority of them are at their baseline happiness level. Okay?
I once had a patient who was a quadriplegic. Her name was Nancy. She was in a car accident where there were 6 people in the car flipped, 5 walked away. She was quadriplegic. And she was the happiest person I've ever met. And people actually swarmed around her just to be in her presence. And it was a pleasure whenever I saw her. And I thought, I was so aware of my physical capabilities and good fortune. And it seemed to me that I never touched a drop of the joy that she exuded from herself every moment of her life. It was extraordinary.
No, it's absolutely extraordinary. And
I've also had younger men, quadriplegic, who actually killed themselves because they couldn't handle it. So.
Well, and this is the thing is, and again, it gets back to this question you ask: how is it that some people are able to overcome adversity and some people give up? And that's the sad thing. In my situation, I met many kids who were like me. Some had it worse, some better, but a lot of them were lost to drugs, alcohol, violence. And I've spent a long time looking at those people and what was it? And again, at least one of the things certainly was that someone cared. And that's really the key. And it can just, when we talk about caring, it doesn't have to be, you gobsmack them every day. Just saying hello sometimes to somebody who's suffering. Just touching somebody. And I'm sure it's probably happened to some of you where you had a situation where you can't even remember, and somebody walked up to you and said, "Thank you so much for taking the time." And you don't even remember it, yet you had an impact. And see, this is the power we're talking about. You have the power to remove that prison. You have the power to take your power back that you've given away. And you have the power to set your intention. And what that is necessary to do that is you have clarity. And clarity comes, though, when you no longer have the monkey on your back biting you all the time. But you have to give yourself to that and understand that. And you have to not be afraid of sitting with that pain. Because, many of us try to push this away all the time. These traumas, these hurts, our shadow. They're parts of us, every one of us has in this room, parts of us we absolutely hate. And it embarrasses us, it shames us, it comes back to us, and we sit there push and try and stuff it in a box. And the reality is, it ain't going to go away because it's part of you. And when you can only be whole when those two merge, and you still realize, in the face of every bit of that you're worthy of love.
I think a lot of people in the room are probably aware of how some of the dynamics that we witness today are being addressed in what you just said. I'm going to come to the last question I was going to ask you. It's not the last question I'm going to ask you, but the last question I was going to ask you. This is still 9 o'clock, is that the case? Yeah, because I want to leave at least half an hour or close to it for these folks to actually ask you questions themselves.
We can go to midnight.
Yeah, we can, yeah. Great. But the last question I had prepared was, you just talked about compassion and the power of caring. And you've got this institute, C-Care, Center for Compassion and Altruism Research and Education. Now, this might seem like a facetious question, but it's not. Sometimes I give my talks and I talk about neurobiology and brain development and trauma and all these things that I talk about, and all these things that Bessel van der Kolk talks about, or Dan Siegel talks about, or Peter Levine talks about, Pat Ogden talks about, you talk about, anybody talks about. And sometimes I laugh and I think, what are we actually saying? We have all this research, we have all these brain scans, we have all these very sophisticated investigative technology. And what are we finding out? We're finding out that if you treat people well, they're going to be okay. And if you don't treat them well, they're not going to be okay. This is what we're finding out. So my question to you is, what you just summarized in terms of compassion, it's just the knowledge of the heart, right? And you talk about it in terms of the alphabet of the heart. Why do we have to research it? Why do we have to keep proving it to ourselves that which our heart... What is it about this culture is what I'm asking. I'm not saying we shouldn't do it. I'm asking, what is it about this culture? Because it's obviously helpful and useful to a lot of people and necessary. But what makes it necessary when it's on a heart level self-evident? So what's the need for that sophisticated research?
I have no goddamn idea.
What's that? I missed what you said.
I said I had no goddamn idea.
You don't, okay.
The problem is that, first of all, we live in a secular society. And, it's hard to talk about this with the president that we have in terms of science and fact, but I will proceed on. In a secular society, generally speaking, if we want to demonstrate an effect, we create a scientific experiment and prove it. If people were to quote to you Buddhist philosophy or the fundamental aspects of essentially every religion, which at its core is compassion. How many of you read Karen Armstrong or Karen Armstrong?
Yeah, I'm familiar with it.
Yeah, so, she's written a number of books about religion. She won the TED Prize in 2008. She created the Charter for Compassion. She got 19 spiritual and religious leaders together together they said, what's the core of every religion? It's compassion. And that's how we've evolved as a species. That's how it's been incorporated to culture, society, and religion. Yet, in a secular society, if we are to incorporate programs where we offer techniques or training to benefit people, generally speaking, we try to have science behind it. The other aspect for me is that there's a subset of people who believe that compassion is soft, right? That it's not worthy of scientific study. And in fact, when I founded the center 10 years ago with academic colleagues of mine, they said that it was a waste of time to put academic effort towards the study of compassion. Yet, I will assure you, the science we have today demonstrates these practices of mindfulness, self-compassion, compassion are some of the most powerful that exist to change your physiology and to benefit you in the context of your own health, mental and physical, and in terms of your longevity. I give a lecture, in fact, where I say, if I had a pill, it had no side effects, the ingredients were readily available, you only had to take it once a day, and it's free. The only requirement is you have to sit in silence for 20 minutes before you take it. How much would that be worth? If I had a pill, I'd be a billionaire, right? Yet we know, as you were just alluding to, so many of our chronic illnesses, so many of our disease states all relate to not being kind to ourselves and people being in an environment where people are not kind to them. You're quoting Aldous Huxley, who said, after 45 years of intense research on my own, I have found that the key to happiness, health, well-being is simply being kind. And it's fact. And for some of you who might be interested, how many of you know Oxford University Press? Mm-hmm. It's an academic press, right? So I'm the senior editor of a textbook that just came out about a year ago called, amazingly, The Handbook of Compassion Science. And it puts together all of this science. So no one can sit there and say it's soft. No one can sit there and say it's BS. And you're right, intuitively all of us know, but you now have science that absolutely validates this, and so that you can in fact say it's absolutely true. And I think while for you and I personally, who intuitively believe this, it's always nice to have that science behind you that says, and we have studies that document the effect. And some people would argue, if you look at some of the literature, that being compassionate with intention offers more benefit than being at your ideal body weight or exercise. Now, that's not to say you shouldn't be at your ideal body weight and exercise, but, being kind and compassionate's pretty cost effective.
So, 100% agree. There's one risk for that for a large set of people. And you actually mention that in your book. You talk about the importance of self-compassion. Because a lot of the people that get chronically ill are people that are extraordinarily kind to everybody else but themselves. And this is my experience of chronic illness. That's almost like a standard dynamic.
And a lot of people go into the caring professions.
Yeah, that's right.
You see, they're hurting inside, And oftentimes when you're hurting deeply inside, you think by caring for others, you won't feel your own pain. But you're not treating it, and you're only making it worse. All these people are going, yeah, I know that.
Well, so maybe you've answered my next question just now, because I was going to ask you a bit about the medical training we received and how it leaves out of account so many of these factors that you've been talking about tonight. By the way, for your interest, my first book was on ADD, and what I argued in it is that it's not an inherited disease, but a trauma response, which just seems so self-evident, really, when you look at it. What is it about the profession and the way that we're trained that we don't see the obvious?
Well, I'll tell you, I had a conversation with the dean of a prominent medical school, which I won't name, that perhaps is nearby here. Not the present dean. And I said, we really need to teach medical students compassion formally. And it's interesting because we just track the levels of empathy that medical students start with, and by the time they finish their training, it dramatically goes down.
Yeah.
Because they're being hurt and they don't have resources. And the statement was, the students already have too full of a curriculum for us to focus on compassion. Right.
When I went to medical school, I had to learn I'm going to try and remember to say this properly, the 8 projections or connections of the habenular interpedicular fasciculus. You know what that is? You must know what that is as a neurosurgeon, no? No?
Habenulum?
Yeah. I had to learn that in great detail. So when they talk about we don't have time to teach that other stuff, you learn so much stuff that I will never... I once asked a practicing neurologist how much of the neuroanatomy that I learned was he using he says maybe 10%.
Maybe, yeah.
Yeah.
Yeah, because I'll tell you an interesting story, because that's what I do.
And by the way, thank you. It's wonderful to listen to you.
Oh. So, a lot of the stuff that we're forced to learn it because it's a rite of passage that has no relevance to anything that you do, right? Yet you're judged on that. And I'm going to tell you a story about my entrance to medical school very quickly. So you can imagine how difficult it was as a child or in college, trying to go to school, have a job, having to get my father out of jail, having to go home to deal with my mother who's attempted suicide again. That could possibly interfere with your grades. And I had wonderful friends who reminded me I would never get into medical school. Remember how these people, you tell them your dreams and aspirations? They would say, you're never going to get into medical school with that GPA. Why are you wasting your time? Right? And one of the things you learn from this woman who taught me the lessons I was speaking to you about is to have absolute belief in yourself. Because there are always going to be the naysayers who will tell you it's not possible, you can't do it, and you have to not listen. And in fact, when it came time for me to apply to medical school, the average GPA, which is pretty close to the same to get into medical school as was when I applied, was a 3.79 out of 4, which is about an A- average. That's the average. My GPA, when I applied, was 2.53. So we had a pre-med committee. You had to go in front of this committee, be interviewed, and they would decide if you were worthy. You would either not be recommended, recommended with reservation, recommended, highly recommended, etc. I went to get my appointment for my interview because I believed. So I go to the secretary, and she says, I'm not giving you an appointment. And I said, well, why? Because it's a waste of everyone's time. Imagine your life, who you are, what you have experienced as a human being is a waste of everyone's time. Who has the right to tell you that. So I said to this wonderful person, I said, I appreciate what you're saying, but I'm not leaving here until you give me that appointment. And if you want to call security, go ahead. And she did give me an appointment. And that was wonderful. But imagine now walking into a room with 3 people who are sitting like this. And then the guy in the center, he takes my file, he lifts it up and he throws it on the table. He says, let's get this over with. Now, I looked at this fellow and I said to him, who gave you the right to destroy people's dreams?
Can I interrupt? What gave you the strength to actually ask that?
Drugs.
Which ones?
Well, I have to tell you, from my experiences, and as a 12-year-old with this woman, every step I took was against adversity. Because again, people judge you. If you're poor, like my high school counselor, she knew my situation because I had to leave school. I said, I want to go to college. And she said, why don't you look at trade school? You're being judged. And we all have a tendency to do this. And this is why it's absolutely critical, in what you do, when you look out at the world, you don't judge people. Because again, you don't know what they're capable of, you don't know what's possible, you don't know what they've been through. So I said to this individual, and I said, there's not one shred of evidence, and this is what we're talking about, just useless information, one shred of evidence that having a 3.79 makes you a better doctor. And I hate to tell some of you this, that some of the guys who had the 4.0s, I would not let them operate on my dog.
Yeah.
Okay? You have to have a certain degree of intelligence. Anyway, I proceeded to lecture these folks for almost 45 minutes without stopping. And what happened is, and this does happen, when you judge somebody unfairly, arbitrarily, and they force you force them to look at your humanity. I am not a number, I am not that file, I am a human being who deserves to be listened to. Once you force that on somebody, they cannot look away from you. That is the nature of this. And at the end of it, they were all crying. So they ended up giving me the highest letter of recommendation. Okay? And as this woman who had been listening in on this, as I walked out of the room, she smiled at me. And she handed me, remember, for you older folks, remember when things were mimeographed? We didn't have copying machines, right? Some of you go, well, was that like a cell phone? She handed me this trifold piece of paper that was mimeographed, and it was for a summer enrichment program for socioeconomically disadvantaged students and minority students, which I never even knew such programs even existed. And I looked at this, and she looked at me and she said, I'm giving you this, but the deadline has passed for this program. But I don't think it'll matter for you.
Well, see what the teaching I'm getting from your story is that you didn't ask for your rights, you claimed them. And some of you who and some of you who've already talked today about, and there'll be many more, about not having your needs met by the others even though you've asked for it. That's the key here. It's not a question of asking for anything. If it's a right, you don't have to ask for it. You claim it. So that's the teaching I'm getting from that story. And I'm going to ask you the final question that I have, and I really want to open it up. Please talk about the heart-brain connection. That's very important in your book. And there's also, you allude to, but you don't detail the research that's been done. But apparently, and correct me if I'm wrong here, that the heart actually has a nervous system of its own. It's like it's got a brain of its own, which actually talks to the brain up here. And so that there's actually, when people have been saying for centuries, I knew in my heart, they did know it in their heart. And this is something that we're now neurophysiologically and neuroanatomically become aware of. So that this connection, and I think you say in your book that many more messages go from the heart to the brain than come the other way. So can you just please talk about that and the importance of it?
So it turns out, and there's another interesting story really quickly, but when there was a neuroscientist who began studying compassion in monks, because of course Buddhist monks, the whole ethos of Buddhism is compassion. And at the time, the technique that was used was electroencephalograms. You know those things, So the scientist was showing these monks the electroencephalogram cap he was going to put on their head, and they all started laughing. And he thought that they were laughing because of the cap. But when they queried the monks said, "What are you talking about? Compassion is here in your heart." And the reality is that's been proven to be the case in the sense that, as Gabor was alluding to, we have what's called the vagus nerve, which is our autonomic nervous system, and it has two parts. One is the parasympathetic system, which commonly is called the rest and digest system, and the other is the sympathetic nervous system. And these are distributed throughout all the organs in the body, but especially in the heart, and it is in fact a two-way street, and they communicate. And this communication is vital to our health and wellness. And in fact, there's something that's called heart rate variability. When you are stressed and anxious, you actually have a decrease in heart rate variability.
Which it means that the heart, even though there's a sort of a heart rate, from beat to beat, it varies.
Exactly.
Yeah.
Because you could have two people have a heart rate of 60 and one who's profoundly stressed and has a decrease in heart rate variability,
right,
and another who's just mellow and relaxed and has the exact same heart rate. The lack of heart rate variability is associated with sudden cardiac death. Okay? When these do not work as was meant to, then you are out of balance. And the problem is that as a species, the engagement of the sympathetic nervous system, or our flight or fight response, was never meant to be chronically engaged. It was meant as a short-term survival mechanism, and then you go back down to your baseline. So on the savannah in Africa, and if you remember, our DNA has not changed for the last 200,000 years. We are the exact same creature that was on the savannah in Africa. If you saw the grass shake, you probably intuited that there was an animal there, potentially a lion. You got up and run, your pupils dilate, you shift the blood from your gastrointestinal tract to your skeletal muscle, your sphincters tighten up, and you take off running. And if you survive, that's great. If you don't, it didn't really matter anyway. But once that event occurred, you just came back down and were relaxed again. Unfortunately, we were never meant to survive in our present environment. That is why we have an epidemic of stress, anxiety, and depression and loneliness. Because we were never meant to be an artificial light. We were never meant to have cell phones going off all the time. We were never meant to be distracted by all these different things. Our job was to wake up, eat, sometimes fornicate, go to sleep, and do it over and over again, right? And as a result, instead of this relaxed mode, this is when we connect our best, when we are in this rest and digest mode, where our parasympathetic nervous system is engaged. We're not afraid, we're open, we connect with others. When we connect with others, it makes us feel good. When we're of service to others, when we care for others, it makes us feel good. We have the release of oxytocin and other neurotransmitters. That is our default mode that we should be in 95% of the time, and we're not. So we use techniques now, mindfulness and some of these breathing techniques, and we have a very specific compassion cultivation training program that we've developed at Stanford, because a lot of these techniques, which are this body survey, the breathing, that's wonderful. That starts you shifting. When you stop listening to the dialogue, you don't have an emotional response, you don't get captured by it and pulled away. That's all great, and that's why mindfulness works. But the other two key components, which we incorporate in our practice, and which we have found to be important, is the next step, which is self-compassion. And there's a whole body of literature on this that shows when you can be compassionate to yourself, it also shifts you over. It allows you to be more compassionate to others, because when you're beating yourself up all the time, it's hard to just look at others without beating them up a little bit too and judging them. And so this physiology that we have, we can actually train ourselves to change a little bit. So when you can shift over from your sympathetic nervous system, this fear and anxiety, even at a low level, which causes the chronic release of catecholamines, other stress hormones, the expression of inflammatory proteins, the depression of the immune system. That is why we have all this illness. And this fear and anxiety is what separates us. Because, 100 or 150 years ago, when we lived in small villages, do you know the thing about living in a small village? You're there with multiple generations of people. And guess what? They have seen you from the time you were a little kid naked to an adult. And no matter how many times you've screwed up, guess what? You're still part of the family. And they love you. That creates a sense of psychological safety. And that's why in those places, people live frequently to over 100 years. And in our modern society, we don't live with our parents, we don't live with our grandparents, our siblings are far away. And so when we're interacting with people, what's the thing that's on our mind? They're going to judge us. If I show that I'm in pain or I'm suffering, they're going to think I'm weak. They're going to think I don't deserve this job. So when you're able to do these exercises, to shift yourself from the stress mode to this relaxed mode, when you understand that your vulnerability is your greatest gift, that allows you to be authentic, and that takes you to this position where actually people embrace you. You see me up here, emotional, tears. I've never had a person go, "You're a jerk, man." In fact, people want to hug me, right?
Yeah, I want to hug you.
But it's true, because you're out there, you're laying yourself out there, and nobody turns away a person who's in pain, or at least very few people do. And that is the true connection, and that's the power of this mind-heart connection, and the extraordinary ability you have to control that. And it's there available for you. We're talking about that free pill. That's the pill. And taking the time. There's a Buddhist saying that says, you should meditate 20 minutes every day. And somebody says, well, I don't have time to meditate like that. So that means you need to meditate an hour a day.
Yeah, I was talking to somebody today who was telling me how there's a yoga practice that we both learned. This person hasn't practiced it. Busy professional that don't have time, but then they spend all this time on the internet and so on, typically, Well, look, what you said about stress is interesting, because a lot of evolutionary psychologists actually say, well, it was so much more stressful on the savannah, because you never knew when a lion was going to get you, but actually, according to what you say and what I believe as well, this is much more stressful,
absolutely,
than we used to. Well, I'd like to thank you for answering my questions, and I'd like to open it up for questions from the audience. And if you have one, please, for Jim, please raise your hand, and the mic will come to you. And we have a hand right here, 2 hands right here. Thank you.
What gender differences have you found in vulnerability and compassion?
You had to ask that question.
Yes, I did. A lot of us want to know.
Well, it's interesting. As an example, if you take a married couple or the male-female, and a female sees their partner suffering, they have a significant response to that, and they want to sue them, but they also have a very similar response to, even if it's a male they don't know. A male only has it to somebody he's has a relationship with, but doesn't have the same feeling towards another, which is an interesting one. But, certainly the nature of how our species has evolved is typically women are much more nurturing, and they seem to have a proclivity for that. And there's some evidence of that. But the interesting thing is I gave a talk on gender roles. And what's interesting is that women are demanding roles that are more typically have been held by males. But amazingly, there are a lot of males who would like to be vulnerable, to show their soft side, to care, to be out there, to be able to cry. Yet society has created the same barriers for them not to be able to do that women have had in terms of, if a woman is aggressive, she's a bitch, right? In the workplace, if she demands the same thing a male would get away with, she's difficult to deal with, right? And so I think while I think women are much more nurturing, caring, and they're typically in the role of the caregiver, I think, though, that a lot of that is a cultural construct.
Well, and it also seems like we say we want men to be vulnerable and open, but sometimes when they are, not so much. Or it's...
No, you're right.
Yeah.
Well, I don't want to sound sexist, and I don't want things thrown at me. So, as an example, there are women who, and I've talked to, and I'm not making a generalization, so please, but there are women who say, I want a man who's vulnerable and who cares and is nurturing to me like I am to him, yet they always pick the self-absorbed narcissist to have a relationship. And then they wonder why it didn't work and why they're unhappy. And in some ways, it's a battle between a perception of the virile male, alpha male, but there are a number of studies that have been done, and this is interesting. Do any of you know Robert Sapolsky? Yeah. So he did a study, and so while the alpha male is running around thumping his chest, the beta male is screwing all the women. What can you say? I keep that image in my mind a lot.
Thank you very much for the great talk, and thank you for your openness and your vulnerability. It's very refreshing. There is a crisis in the healthcare, and I think a big part of that crisis is that the providers lost touch with what they do and lost touch with patients. What do you think, what would be a solution from your perspective to this problem, both on a larger scale, but at the same time, and maybe most importantly, for each provider to kind of change their perspective?
Healthcare should never have been a for-profit business ever. Asking you to put a price on the care of another human being who is suffering is an insult. It should never have ever happened. And to be honest with you, this is the failure of capitalism, right? When it's profit at all costs, when you are encouraged to create more wealth inequality, we have a real problem. When a large percentage of the population don't have health care, how a society cares for its most vulnerable is a statement about the worth of that society. And we have a serious problem. We have a lack of empathy crisis. And unfortunately, when people are suffering, when they're in pain, and again, I'll head off into my thing here, when, the middle class has been robbed and there's no middle class, and that's why we have 40-year-old men, an epidemic of depression and suicide. They have no future. When you take away hope, when people live in despair, and whether it's about not having health care, not being able to provide for their loved ones, it's an absolute disaster. we as a society should make every effort to care for the least among us as well as the greatest among us. Whatever criteria it is, we are all human beings, we're all equal. No one deserves something that someone else doesn't get. And I'm not talking about a communist and redistributing income. I'm talking about at a basic level, giving person their dignity.
Well, so 2 points. One is that I talked about this today actually in almost similar terms, except I wouldn't say it's a failure of capitalism, it's a success of capitalism. If the intent is profit, it's very successful. Number one. Number two, you just said that we live in an age of failure of empathy. You also say in your book, we're living at the beginning of the age of compassion. So I want you to put those two together for me.
And we are. And what's going to save our species is compassion. And we're at the beginning of the age of compassion, I believe, because the lack of empathy, the lack of compassion is a full-blown failure and is going to destroy our species. But like the age of enlightenment, it didn't happen over 1 year, 5 years, 10 years. It happened over 100 or more years. And I think we're now recognizing that when we start recognizing that whether you live in a third world country, whether you live in a first world country, you have a right to live. When we look at the world in a different way and don't look at it as us against them, but that we are all human beings in this world, and that has to happen. And I believe it is slowly happening, and I believe some of the things that we're seeing are the last gasps of a failed system. And when you look at all the people who are striving to be more self-aware, who are striving to be more connected, who understand the failure of modern society. I mean, look at this. We have people who immigrate here from some of the countries with the greatest wisdom traditions ever. And they come here because they think we have it better, right? And they buy into this consumer society. I mean, look, the United States uses 25% of all the world's resources out of 8 billion people, 360 million people. This is not right.
You know, Michael Pollan, the writer, said in Vancouver last couple of weeks ago that if the average Chinese started eating as much meat as the average American, which is something like 9 ounces every day, you'd have to have 2 other worlds the size of the Earth just to allow for the meat production. Okay, back to you. Other questions for Jim? Yes, please.
Did you stay in touch with Ruth?
Actually, it's an interesting story, another story. After that summer, a lot of things changed. And you know, I say a lot of things changed, but what's interesting, my personal circumstance did not change one iota. But what did change, and what I didn't realize, is that when you carry anger, despair, a sense of hopelessness, fear, as a species, we have the ability to read microfacial expressions, body habitus, smells, and when you carry that with you, people respond to that. So what I say is, even though my circumstance didn't change, I changed. And when I changed, how the world interacted with me changed. You see, because it shifted, because people wanted to help me. I wasn't screaming, I wasn't holding myself, I wasn't angry at every event that had happened to me. It went from being angry at my situation to understanding it was just a situation. And those are completely different. It went from me looking at my parents and having anger and hate and hostility about their failings, and also their not being there to nurture me the way I needed to be nurtured. And the reason was they did not have the tools themselves to care for themselves. And that's like being angry at somebody for something they can't help. So when I released that anger and understood it was just a situation, that released me. And we were talking a little bit earlier about losing everything. Over 6 weeks, I lost $80 million and was $3 million debt. And the thing is, when I reflected on that experience, what I realized, even though I was a good doctor and a nice guy, it was all about me. The goals were about me. I had to do this, and this. When I reflected on this and realized that, versus finally understanding that meaning, deep happiness, contentment is a manifestation of caring for others, that's when everything changed. And so and at that point, the only asset I had left was this stock in this company that you had alluded to, and I gave that all away to charity instead of taking it. And that company that I had run and been the CEO of went public for $1.2 billion. Oh. But what did that do? It liberated me, right? I wasn't thinking about all the stuff that I wanted, that money was going to get me into power. I was liberated. And I set up health clinics all over the world, built blood banks, set up programs for AIDS, HIV, set up research programs, and it funded the initial funding of the center at Stanford.
But look, I'm just wondering where you're going with this answer, because the question was about Ruth.
I'm getting there.
You're getting there? Okay, good.
But you interrupted my train of...
I know, listen.
The reason this comes back to Ruth is Ruth asked me to make a set of things that I wanted. When I reflected on this brought me back to what really Ruth really wanted to teach me, was to be connected to my heart. But after about 9 months, I went back to see her, and this was at a strip mall, and it was quite a ways from my house. I went back to see her, and the strip mall was vacant, and there was a fence around it. And in fact, I used to ride the Stingray bike, and I rode up there, and I wanted to see her. I was so excited, and it was beginning to be dusk, and the sky is sort of blue with these wispy clouds. I get there, and there's nothing there. And it was as if she was there just for me.
So she never knew that you became
No.
But you did connect with her family later on, did you not?
I connected with her grandson.
Yeah.
And what's interesting about that is that the grandson, the parents were divorced. She had actually come there to be with the grandson who was supposed to visit the father. And the parents got into an argument. The mother wouldn't let him come. And so she was there without her grandson. And that's where I walked in.
So you became the grandson in a sense.
Yeah.
Wow. And then you found out later that she died of breast cancer.
Yes. Mm-hmm. Yeah.
You know how old she was when she died?
Actually, it was within about 6 or 7 years after, so it's probably late 50s, early 60s, yeah.
Okay.
So,
Thank you.
so that was a roundabout way to get. But I had to teach you that other lesson that came in there somewhere. Another question?
I'm here because I'm wanting to learn other tools and ways to heal my body. I have chronic pain from nerve damage. It's in my neck, and I've been learning all of these different techniques. And
Can you hold the mic a bit closer?
Oh, I'm just trying to figure out how to really integrate all of this knowledge and to be able to live it. I just find that's a hard part for me. And also just being with family that is not supportive and is really judgmental of, whatever process that I try and take. And I have like severe pain, and I have a lot of judgment around me for taking medication. And I have ADHD, and which I also get a lot of judgment for about. And I'm just wondering, from your experience of being a neurosurgeon and healing, how to go about that, and while still like living around people that are like in my life, that are like lifetime relationships.
It's very challenging, and they're not easy answers sometimes. You have to ask yourself, I think, one, do you have to be around these people? Because, anybody who suffers pain, anytime there's negativity, there's judgment, it exacerbates pain. And in fact, oftentimes, the source of the pain may in part be physical, but a lot of it is not. And it is a manifestation of the negativity that is sort of being poured on you. And it can be very difficult and challenging to overcome that. And the other side of it, unfortunately, is a subset of people actually become dependent on that as to how they move in the world. And so this is a very difficult process to deal with that and overcome that. The other thing that I think most people who deal with chronic pain is now narcotics can be helpful in a number of instances, but for a lot of people actually getting off of the narcotics, they realize that they're in less pain. And there's a friend of mine actually.
They're in less pain when they get off the narcotics?
Yes,
okay.
yes. But you have to go through withdrawal, and that's a challenging thing. And then there's a colleague of mine who almost committed suicide because of chronic pain, a spine surgeon, actually. And he found a technique which did not involve medication, and he wrote a book called Back in Control, and he's literally changed the lives of thousands and thousands, if not more, people who've had chronic pain like you're describing. And his name is David Hanscom. And if you look up his book, Back in Control, and I actually give that out to a lot of patients.
Okay, thank you.
This young lady's dancing over here for us.
Am I too close to the speaker?
Hi.
Hi. How are you?
I'm fantastic. How are you? Thank you for coming. So I totally agree with you that the human race is evolving, and that part of us realizing that we're all human is kind of the term you said, is taking the role of other, becoming more empathetic, as you're saying. But it also kind of jumps over into the spirituality realm where we're all one, right? So we're not just talking about the human element, right? The sense or feeling, at least it does for many people, that there's something bigger. So my question...
It's going to be hard.
It might be, it might not. And some of those feelings of oneness have been recreated by stimulating parts of the brain. And so what do you think, the first question is, what do you think of brainwave entrainment and assistive technologies to help get to certain brain states? And how, second part, how do you feel that relates to the heart?
Well, I think that, there are techniques where you can entrain the brain and the waves of the brain. And there are a variety of technologies now that assist you with getting to these meditative states. Muse, do you know Muse? So Ariel was just with me, and I had lunch with her earlier today. But they all work. And again, this is the other direction. When you are content in your mind, you are content in your body, right? As an example, it's like this saying, when there cannot be peace on earth until you have peace within. And these are techniques that allow you to get there. Now, in my book, I say this, and many people don't believe this, but I say I'm an atheist. I don't believe in anything. But in some ways, I believe in everything. You know, I have relationships with really a number of spiritual leaders, the Dalai Lama, Thich Nhat Hanh, Amma, and some of these other people. And I'm close to these people. But that being said, at least for me, I don't need those people to help me be good. You don't need a dogma to do that. And if you spend any time with an evolved spiritual leader, you will see that, do you know what they are most interested in? They don't ask you to recite the Heart Sutra. They can read who you are right here in a microsecond. If you're authentic, you have an open heart, and you care. That's it. You don't need any of this other stuff. And now for some people it's very helpful. It guides them. It's a framework for ethics, values, and morals. But you can walk the world without any of these things and care and love and see a oneness in all of us. I mean, science shows we're all evolved from one. And when we connect more with others, science shows, and I intuitively feel happier. When I smile at you, when I give you love, when I hold you, I'm happier. And I think that's true of most people. If you let your guard down, you show your vulnerability, you don't judge others, you embrace the other. And when you're there, that's your highest state.
Thank you.
Thank you. Inspiring talk for somebody who's going through a lot of the same obstacles that you've gone through. Nice to see you on the other side. You mentioned that empathy in medical students goes down over the course of their study, and that the curriculum is too busy to teach compassion, and we know that med students are, their immune systems are more suppressed during exams because of how stressed they are. Our residents are working 15 hours a day, 6 days a week. How would you suggest that they maintain self-care, compassion, and empathy during this training?
Well, there's great interest in this. Some of it's lip service, but probably 30 to 40% of medical students are on antidepressants.
Is that right?
Oh, it's huge. It's huge.
Incredible.
There's a huge problem in people dropping out of the profession, especially women. It's a brutal, demoralizing process to become a doctor. And frankly, they use doctors for free labor, or residents in training. And it's a horrible system. Now, do any of you know Kelly McGonigal? She wrote a book called The Good Side of Stress or something. Yeah. So you do need a certain amount of stress in your life. We call it eustress, to make you feel satisfied, to make you feel connected, to make you feel you've accomplished things. It's when it's chronic and overwhelming that becomes a problem, and that's the nature of medical training. So it's not to take away all stress, because you need that actually to grow, but it's to create a much more healthy environment. But again, when we talk about a healthcare system that makes the demands that we're talking about, it's a horrible system. I mean, look, we're in a country. Imagine if we look at the top 10 industrialized countries. In the United States, we have the highest cost of healthcare, the highest level of dissatisfaction among patients. In almost every in every measure of efficacy, we're in the lower quadrant. What do we have that we are somehow better than any other country? Yet when you look at other countries that incorporate some of these, what would be called alternative medical practices, less testing, less medicine, more self. We have a system in the United States of illness, not wellness, right? That is the fundamental problem. And when we focus on each of our wellness, when we focus on medical students and their self-care, and again, there's a lot that's trying to be done, but it's so far behind the 8 ball still. It's very challenging. And again, we have people constantly leaving the medical profession. Why would you want to be a doctor? You can't even take care of yourself, much less have the time to care for a patient. That's why I tell you I'm the lowest paid neurosurgeon. Truly, I am the lowest paid neurosurgeon because I am only paid by procedures, period. I refuse to participate. If it takes me an hour to see a patient or 2 hours, that's what I take. I don't care. If they want to fire me, fire me. My job is to be the best doctor I can be. Now, you cannot be in that position as a medical student or intern. I mean, I can remember times I was in the call room one time. I'd been up for 36 hours straight. I was so exhausted. I was in the call room. I started crying. I said, "Dear God," as an atheist, I was saying, they say there's no atheists in foxholes. There's also no atheists when the plane has turbulence. But I was in my call room, and I was literally crying. I was going, "Dear God, please don't let the beeper go. I can't do this another, dear God." And then my beeper goes on.
It was God.
And it was God. Yeah. And I answered, and I'm here. But it's very challenging. And that was so horrible for me to have to live through that. And I survived. But frankly, I could have also gone over the deep end potential. I don't have a solution for that. I think a lot of efforts are being made. We have programs that we teach at Stanford for a lot of medical students, residents, and faculty, and there are a number of other programs. But we're not there yet.
Well, thank you. I'm going to make a final statement and ask a final question. Okay. Thank you. The statement I'd like to make is that I look forward to this evening, having read the book, as a potential to have an interesting conversation. I did not expect to be touched by your presence. And I have been, and I think as everybody else here has been as well. So thank you very much for that. The question I'd like to ask just occurs to me is very simple. What's it like to be Jim Doty these days?
Ask my wife. Well, look, I'm one of the most blessed people in the world. You know, when I lost $80 million in 6 weeks, Oprah called me up. Said, "Oh my God, this must be the worst thing that ever happened to you. How could you, your house has been sold, you had to sell all your cars, da da da." I said, "What are you talking about? I am the most blessed person in the world. I mean, how could I even complain when half of the world's population lives on $2.50 a day? I'm complaining because I'm a neurosurgeon and $3 million in the hole. I'm blessed." And so every day to me, regardless of what happens, is a blessing. Because each of us, whether it's you or me, we have the opportunity to love another person, to connect, to embrace somebody who's suffering. And we have an immense power, every one of us in this room, to change one person's life every day. And you forget it. And you also sometimes get lost in your own stuff. Yet around you, there are others who have much worse stuff than you. And when you take that energy of oftentimes being self-focused on how horrible and crummy it is for you, you just have to look pretty close by and somebody has it much worse off. So I can't ever not be happy. I can't ever not feel incredibly blessed. So that's what I try. So for me, that's where I try to sit, being thankful, having gratitude, offering forgiveness, and trying to be present. But what happens is when you write a book like this, which some of you I'm sure have not read, in fact probably the majority of you, when you lay yourself out there, when you're completely vulnerable, people connect to that. And I have all these people come up to me and they go, "Oh, Jim, I want to hug you." And I look at them and they go, and I think I can never know if I really know them from somewhere and I've forgotten, or they're just somebody I don't even know at all. But I have to pretend I know them. So it's very interesting. But again, I'm very thankful.
Well, thank you so much again. Thank you.